I'm Angela Javenko, and I'm here with Dr. David Kalin, the Executive Director of the International Board of Medicine and Surgery. Dr. Kalin, since the establishment came in 2002 after the conception of your 8th child in Korea, do you feel that that was a motivation for the development of this organization?
Absolutely, Angela. I mean, as you can see in this picture, I'm so proud of my 7-year-old son who was conceived in Korea. My wife is Korean, and after 3 failures in the United States with all those costs, you can imagine the pride that we had in this event. So the cost was 1/3, and my wife was able to be with her family. So I thought to myself, this is the type of thing in a global marketplace that would be good for other people as well who may have other health or medical needs. And so I started to think, well, how do we develop and look for the finest healthcare providers in the world and create a concern for patient safety and professional integrity?
With such an overwhelming success and the growing trend of global healthcare in our society today, what is the International Board of Medicine and Surgery bringing to the medical industry today?
We bring a focus on patient safety. We look for complications, potential pre- and post-medical evaluations and treatments. How are those things being handled? How do we create communication so that we can maintain and enhance the patient-doctor relationship when people are going overseas?
So how would one gain information on the International Board of Medicine and Surgery?
Not only are we a member of the Medical Tourism Association, we also have our own professional online web registry. And we list our physicians. And the ones which have a gold seal would indicate that we've had notarization and or third-party verification and documentation of indemnification for potential complications. We also have contracts with 3 independent healthcare travel sites which highlight our certified members and our affiliated members. Our affiliated members being healthcare travel associates or medical tourism travel companies who want to be associated with our standards, as well as medical industry professionals who create infrastructure in the global marketplace, Centers for Healthcare Excellence, which are hospitals and clinics, and professional associations working in the field of medical tourism, providing services and enhancing standards around the world.
The International Board of Medicine and Surgery strives to provide patient safety and professional integrity while bringing the highest quality patient care. What does the International Board of Medicine and Surgery have for the future? What is the mission?
Our mission, to summarize, is, as I have said, is safety. We look for efficacy, confidence for the patient. We look to increase our exposure and the visibility of our certified members, physicians, surgeons, and dentists as we seek the finest in the world. We're concerned with emergencies, as I said, complications, infection control, and we're working to assure the public that these things are controllable. We in actuality are one of the only organizations that have a physician voice in the medical tourism industry. We are the ones who are the global healthcare engine behind the hospitals and all the other people who are in this industry. We have a vision to create a Congress where we can discuss these types of issues that are unique for physicians. Communication, medical records, translation, intercultural treatments, as well as more of the types of specialty treatments that are proliferating around the world. Our goals are distinct from various other organizations, which may focus on plastic surgery or orthopedics. We focus on the patients moving around and knowing that our doctors have the types of credentials to take care of them, but they also take care of them within the context of people moving from various country to country. We recognize the jurisdictional boundaries, and we work with our International Board of Medicine and Surgery, IBMS Advisory Board, who are members of physician surgeons and dentists throughout the world to bridge the certification process globally. And so, as we look to the future, we look to our Executive Vice President and CEO, John Lloyd, to carry this flag forward and meet the needs of those people and those organizations which wish to be members of the International Board of Medicine and Surgery. So I thank you very much for your questions, and I hope that this answers them.
Thank you, Dr.